It looks like they're suiting up for space travel.
Thank you. All right, you can go on in.
But patient Walter Johansson will actually experience something more like a trip to the depths of the sea.
And then once they get to the bottom, we have these oxygen hoods that we just pop out like this. And we slip on the patients like this.
This is a state-of-the-art hyperbaric chamber at Ronald Reagan UCLA Medical Center. Today, Walter will spend almost 2 hours in this large capsule at pressures equivalent to 40 feet under the sea.
So he has a diabetic wound to the toe, and diabetic wounds are known to be wounds that have poor perfusion to the wound. There's low oxygen levels to the wound. And even though they don't demonstrate blockages of the major arteries, the wounds themselves have poor circulation. And so hyperbaric oxygen is used to penetrate those tissues with high concentrations of oxygen that really couldn't be achieved in any other way.
Walter has been diabetic for about 16 years, resulting in neuropathy or a numbness in his feet that has led to this chronic wound on his toe.
It got to the bone, so it was osteomyelitis, if I said that right. And that is serious because that is a possible amputation, and which I'm here to avoid that.
Air is pumped into the capsule, simulating the pressure of a scuba dive.
So it's the same as a diver going underwater, just no water. So it's creating the same effect inside your vessels in your body.
Once they reach bottom, serious wound patients like Walter and others with wounds from radiation cancer treatment, and even patients with various bacterial infections, breathe pure oxygen to help them heal.
Okay, so we've just reached the bottom. The patients are now at 40 feet. The inside operator is putting them on the hoods. So the patients are going to be on oxygen for the next 30 minutes. They go on oxygen for intervals of 30 minutes at a time. They're taken off for 5 minutes, 30 minutes at a time. They'll be down about 113 minutes total, so almost about 2 hours.
Yeah, the hyperbaric oxygen, by having increased pressure, actually condenses the gas, and so there's more molecules of oxygen. So when you breathe, you're breathing much higher concentrations of oxygen.
Walter has been coming daily for 2 months, hoping to reverse the damage and keep his toe.
His wound was much deeper, much larger. The wound actually probes all the way down to the bone. Since coming to hyperbarics, the wound has filled in from the inside out, and we are now in the stage of skin growing over the wound completely.
So far, along with other expert treatment at the Wound Care Center at UCLA, Walter, who used to teach scuba while going to law school at UCLA, is getting better.
Well, I'm very happy to be at UCLA. You get the best.
UCLA, I believe, is a leader here in Southern California. There are many different wound centers, but there are also hyperbaric centers that are designed more for diving emergencies. We're able to handle all of the patients. We can handle any type of emergency. And there are a few centers that really have those capabilities.